I'm going to direct this question to Cindy. How does working with Medicare or Medicaid differ from private insurance?
I've always said that Medicare rules the roost. Your private insurances, whenever Medicare implements a policy, usually follow suit, especially regarding reimbursement. Medicare tried to lower reimbursement over the years, but the last couple of years has actually upped it due to all the flack that they received. And all the insurance company contracts that we've negotiated in the last couple of years have reduced their fee schedules to what Medicare has. So it's been a struggle to deal with that. A lot of your policies regarding claim processing and diagnosis procedure rules, your private insurance companies pretty much follow suit with that as well. My mind's going blank. Electronic-wise, Medicare is one of the first companies that insisted that everybody go electronic with their claim processing and not go on paper. The other insurance commercial companies haven't quite followed suit with that yet, but we're looking forward. There are some good things that Medicare implements that we're looking forward, that the other companies will follow suit with. That's it for now.
I'd also like to say Medicare used to be our best payer. 20, 30 years ago, when I first started practice, Medicare was a good part of your practice as far as reimbursement to have, and the other, as Cindy said, the private insurers would have to keep up with Medicare. But what's happened with Medicare over the years is it's been distorted from its original intent. It has involved more private insurance companies, which have siphoned off additional administrative fees that Medicare does not have. Medicare runs at a 3% overhead administratively, and all private insurers run from 17 to 31% in administrative overhead and profit. So when, in the last 8 years, Medicare pieces have been farmed out to private insurers, we've been seeing a marked increase in the cost of Medicare to our nation. And because of that, what's happened is they've cut payments, as Cindy said, to the providers. So to be able to pour more profits into the private insurance industry, they have taken those profits from doctors who increasingly have said, we're not doing Medicare anymore. And I know several colleagues in this community who've stopped taking Medicare because of that. And as Cindy points out, all the other private insurers then look toward Medicare to what they'll reimburse. But understand, as the private insurers drop their reimbursement, they're still pocketing their profits and their overhead. So it's really one of the reasons that in this recession, healthcare stocks, private health insurance stocks are one of the just flying high stocks out there, because they're still raking in the profits. In fact, the worse the recession gets, the more health suffers. That's another research bit of data. And so the more they stand to gain, ultimately, because people are sicker.
I will say, from a mental health perspective, one pro of Medicaid is that they actually have more services than private insurance. So if you have private insurance often and you have a mental health issue, they will limit your number of sessions. And so they'll say, well, you have 6 sessions because you have an adjustment disorder. You have 12 sessions. And this is just my understanding because I don't deal much with private insurance. But I have never, with CareSource, which is the primary Medicaid agency in our area, had to in any way limit the sessions I have with clients. So they've never said, you've had enough. And so that actually has been a pro. And some of the reading I did for today did say general Medicaid has better services for mental health than private insurers. On the other hand, their reimbursement is incredibly low. And so there are a number of private insurers who are therapists that don't take Medicaid. We at Osterland have something, I think it's from a different agency than the Rocking Horse, but I think the Ohio Department of Mental Health doubles the Medicaid payments that we get. So that makes it more affordable for us to treat people on CareSource, where if you're someone in private practice, you only get the basic Medicaid payment, which is, I think, around $35 to $40. And so I actually once tried to have a student seen by somebody in private practice that had been recommended for the student, and I called the therapist and said, well, and this was a student in very desperate need who was on CareSource, which is not our typical student, and the therapist told me, no way, it's basically free labor by the time she does all the paperwork for the reimbursement she gets, and she just turned me down flat. So that is a negative. But for Osterlin, since we get the matching funds, we have pretty good reimbursement.
Yeah, I guess 2 points. One about Medicare and the HMO. If you've been following the healthcare reform debate at all, I'm sure you have. It's probably why you're here. The Senate Finance Committee bill that's being pushed by Senator Baucus from Montana, one of the components in that is a proposal to cut payments to the Medicare HMOs. And those, for a long time, Medicare was straight paid by the government, as Dr. Grove said, and the administrative costs are about 3%. During the Bush administration, as a result of some reforms, particularly related to the drug coverage that they now have, they allowed some of Medicare to be managed by the HMOs, as Mary Jo said, and these are private insurance companies, and they're providing a little bit additional benefits, for example, maybe a health club benefit, perhaps. But in an effort to try to figure out how we're going to balance all these costs, part of what's in the Senate bill says that there will be some reduced payments to the Medicare HMOs. Well, those private insurance companies, those HMOs, got all upset, and they emailed all their senior citizens and said, you better call your Congress members because they're going to cut your payments. This wouldn't have happened had we not gone to Medicare HMOs. So here we are in a sort of situation where the seniors are kind of afraid that they're going to lose their health care or their health fitness center membership, and I don't blame them for that, but that's actually what has happened. So we'll see how that shakes out, but that's one of the issues that actually there was a little dust up about in yesterday's news. On Medicaid, the straight reimbursement is around $35 to $40 for regular health care. For behavioral health, as Dr. Little points out, if you are state mental health certified, then there is an enhanced reimbursement that you do receive. And Rocky Horse Center is mental health certified through the state of Ohio, so we do get an enhanced reimbursement for our behavioral health there, and that's an important thing for our providers.